Warm greetings from Identity Pediatric Dental Clinic. I'm Dr. Poojan Kamath from Manipal. So today I'm here to give you all recommendations for the oral hygiene protocol for children, and my focus is going to remain on infants and toddlers. So the biggest question that I face from new parents is to brush or not to brush. Now, when you have an infant to take care of, you have a newborn in the house, the entire focus lies on satisfying their hunger cues. And in general, dental awareness is highly lacking all over, and especially more so when it comes to children. So, while we are always thinking of satisfying their hunger, we forget about cleaning or, maintaining the oral cavity post feeds. Yes, that is equally important. So, before I start off with how do you actually need to do it, let me break a few myths. The first biggest myth is new parents approaching me with the question of, my child doesn't have teeth. Do I really need to clean my child's mouth? Yes, definitely. It's a very, very important part of oral hygiene initiation. What we call it is the cleaning of the gum pads. Needs to be started immediately post birth and needs to ideally be done post every feed. Just the way you are expected to go and rinse your mouth each time you eat something. Now, why is it so important? Now, it ensures a favorable environment for your milk teeth to erupt into the oral cavity and also keeps your subsequent bacterial colonization under check. The second common myth that I face is milk teeth are eventually going to fall. So, why so much focus on the oral hygiene maintenance, in this milk teeth? Unless and until my child has pain, why bother? Now, trust me, milk teeth are there for a reason. Maintaining them in a healthy state is very, very important for the development and the favorable eruption of your permanent teeth. And there are a lot of other roles that your milk teeth play or they perform, which I will definitely be covering in the subsequent presentations. Now, so the Bible for pediatric dentistry is the American Academy of Pediatric Dentistry that lays down a few guidelines for for international standards. So the first thing that the AAPD recommends is, yes, cleaning of gum pad is a must. Needs to be done at least once per day. And you need to classically sit in the lap to lap or the knee to knee position. So it could be both the parents, it could be two primary caregivers, it could be a primary caregiver along with a nanny. So why stick to this position is because it is a very good way of visualizing the oral cavity and cleaning, because it's not going to be an easy task with an infant. So the person who's going to do the part of the cleaning needs to be at the head end, while the person at the foot end is the one who needs to keep the child engaged, sing to them, narrate a story, talk to them, basically keep them engaged and, help them gently restrain their hands. Now, how do you do it? We are going to run a small video of how do you actually do it to demonstrate. We are demonstrating the cleaning of gum pads for a child before the eruption of teeth. So here we have somebody who is just 4.5 months old and his gum pads have been cleaned since he's 15 days of age. All it requires is very simple armamentarium. You just need well heated pre-boiled water and a soft muslin cloth or a cotton cloth which is absolutely clean. You need to wind this cotton around your index finger. And all you have to do is dip it in the water. Now the position for seating the child has to classically be in the lap to lap or the knee to knee position, with the person sitting at the foot end with the feet on both sides and the hand restrained, and the person needs to vocally communicate with the child in a friendly manner, and the person at the head end needs to look into the mouth so they can visualize all the areas and clean. So starting off with the cleaning procedure. Yeah, so all needs to be done is you need to swipe your finger along the alveolar ridges all along, both anteriorly and posteriorly, also including the palatal surface. You could dip back into the water. It's as simple as that. So we finished with the upper gum pad cleaning.
Now the lower gum pads need to be cleaned both on the outside and the inside, that is on the side of the lips and the cheek and on the side of the tongue. And last but not the least, we also need to focus on the tongue because that's the area which harbors the maximum bacteria. If this procedure is followed in a pre-dentate child, it helps the transition to a finger brush, and gradually brushing of teeth becomes really simple. And it's an absolute painless procedure. As we can see in the water, there are some white particles, so that could be residual milk, or it could be some deposits on the tongue which get cleaned off. Akarideva. Babu. Good boy. So it's as simple as that. Thank you.
Now, this is the protocol for the first 6 months, that is from birth till about 6 months on an average till you get your first milk teeth. So once you get the first milk teeth, you need to transition to a finger brush. So a finger brush is a silicone brush that you will have to slip over your index finger. The position, that is the knee to knee, the motion, the still, everything else still remains the same. But only thing is you're going to use a brush in the areas where teeth have erupted. You're not going to be needing any paste at all at this point in time. Progressively, as more and more milk teeth erupt, you're going to be needing to introduce a fluoridated toothpaste. Now for that, I will genuinely recommend you visit your pediatric dentist. Now, the ideal time to visit your pediatric dentist would be by the time of eruption of the first milk teeth or no later than the first birthday. So, generally what we recommend is a smear quantity or a rice grain size quantity to begin with. And then as the child masters the art of spitting, does not swallow the paste, you can increase it to a pea-sized quantity. Now, as the child enters toddlerhood and is more proficient at his motor skills, while the responsibility of brushing still remains with the parents, please let the child handle the brush. Put them into a practice of visualizing the teeth in a mirror, seeing their teeth and brushing. So let them develop the manual dexterity, the motion of up and down, round and round. So slowly, make them feel responsible for their oral hygiene protocol and, their oral hygiene care. Also, the main key when it comes to oral hygiene is keeping your child motivated. You really need to keep them motivated. So, you get a lot of motivational charts, toothbrushing schedules. Just paste it along the wall besides your wash basin. Every time they brush in the morning and night, let them tick by it. And once the entire chart is completed, you can present them with a nice goodie. So morning and night brushing is mandatory. In fact, I really like introducing a third toothbrushing. Could be after lunch, or especially if the child is a school goer. A third brushing after school really helps from a practical point of view, because you're really not sure what the child has eaten from somebody else's tiffin box in school, whether the child has rinsed his oral cavity or not. Another very important aspect of oral hygiene is mouth rinsing, and highly neglected. Like, while a lot of parents tell, ma'am, after you've told my son is brushing perfectly 2 times, but when I see the child in my setup, there's food all over. So please train them and teach them to rinse their mouth. It's not only about holding the water in the oral cavity and spitting it off. You really need to teach them the art of swishing it. Keep it simple, right, left, and count. I like it that way because they get a fair idea for how long they need to hold the water in the oral cavity. So count 1 to 10. Even if the child is able to hold the water from 1 to 5, it's a big achievement. Now, some children have a closed dentition. When I say closed dentition, that means there are no gaps in between the teeth. So in that cases, brushing might be a little more difficult. So if you've already mastered the art of brushing and mouth rinsing, the next step would be flossing. We as pediatric dentists train parents. We also teach the child to floss. You get handles, which will make flossing much more easier. So all this needs to be, learned under the guidance of your pediatric dentist. So some of the key points that I would like you to take away from my presentation are: first, start early to stay healthy. Second is, please stick to the lap to lap or the knee to knee position through infancy. Be consistent. You need to be regular. It's not that I do the protocol for 1 week and then let go. It is something that has to be a part of the child's routine. Then you need not remind the child to brush every night. He's invariably going to go pick up the brush and brush on his own. And the fourth, very, very important, is be persistent. Don't give up or give in. See, there are going to be good days, there are going to be bad days. There are going to be days where your child is not going to be wanting to brush. Please, patience is the key. So the next topic in line, I would like to discuss a very important milestone from the dental point of view, that is teething. And it's often a very feared, developmental milestone in the minds of the child. So the next topic in line is going to be teething. Thank you everyone for your patient hearing.